Good afternoon, everyone, and thank you for being with us today. We are going to speak about the Center's resources to support aged care organizations. Now, we are going to start off with About Us video, which basically describes the work that we do in a beautiful presentation produced by Red Hat Film.
There's big change happening in aged care through the reforms. If you work in aged care, that's a lot to keep up with. We get it. That's why we offer you practical support. Culturally inclusive aged care is becoming more and more important to the government. The Centre for Cultural Diversity in Ageing can help you prepare for this. Culturally inclusive care considers the unique social, cultural, language, religious, spiritual, and psychological needs of each older person. Embedding culturally inclusive policies and practices into your organisation puts you ahead. It prepares you to meet your regulatory and compliance responsibilities. It's an essential business practice because consumers have choice to go with services that best meet their diverse needs. Most importantly, you'll offer the care that older people need to live safely, comfortably, and with dignity, where their unique culture is recognised and respected. Embedding culturally inclusive policies and practices into your organisation is a long process. If you're starting now, halfway through, or advanced, you are ahead of the change that's coming. And we're here to help. The Centre for Cultural Diversity in Ageing. We'll keep you up to date with government information about supporting diverse consumers. We'll listen to you and amplify your voice back to government. Our website is full of resources you can use to support culturally diverse older people, their families and carers. Our inclusive service standards provide a framework that supports your organisation to become truly inclusive. Our online training series supports you and your staff to build cultural competency skills. We provide mentoring, tailored training and consultations. We support you to build relationships with other organisations and share good practices. The Centre has been supporting the aged care services sector for over 20 years. We're recognised nationally and internationally for our expertise. We're funded by the Australian Government Department of Health and Aged Care through the Partners in Culturally Appropriate Care program and supported by Benetas. We're here to support you with the latest government information, resources, tools, training, mentoring, consultation and relationship building. Visit culturaldiversity.com.au to find out more.
On the slide, we have the webinar topics that we have for this financial year. In August, we have culturally appropriate responses to elder abuse. Then if you're interested to become a specialist call provider, that's in September. In October, we will want to focus specifically on home care because people were saying to us, we want to have information and resources on how to deliver culturally inclusive home care services. Then racism and discrimination experienced by the called workforce is another issue that we got as a request. And also workforce is a high topic, an important topic at the moment. So we thought we include that as well. In January, navigation service will be one of the topics as well. This one was last financial year, our most successful webinar with around 200 people attending. So we thought this is one of the webinars we sort of do with different presenters again. And then in February, the right to communicate, we will talk about the free translation project that's funded by the Department of Health and Aged Care. March, we'll be focusing on supporting carers from CALD backgrounds. And then April, we have a webinar that will jointly co-facilitate with the Aged Care Quality and Safety Commission and the Centre on providing a culturally inclusive lens to the new strengthened aged care quality standards. And then in May, new and emerging communities and their aged care needs. So we're talking about recently arrived communities. And then June is about intergenerational, intercultural initiatives. This is less than a training, it's more sort of a conversation, learning about best practice happening in that space and the sector. So if you would like to book our webinars, feel free to go to our website or look at the QR code now. You can scan that and register for our webinar series. We developed a joint module with the Aged Care Quality and Safety Commission. Everyone has a story that any aged care organization can access for free through the ALICE platform of the Aged Care Quality and Safety Commission. This is a short course about developing culture inclusive care, and it's pitched sort of at the organizational but also delivery aspect. So have a look at our website and then see if that's something that is relevant for you. Just have to make sure you're registered through the Aged Care Quality and Safety Commission ALICE platform. Then the diversity mentoring program is one of our key programs that we run. So we help organizations across Western Australia, New South Wales, and the ACT, and here in Victoria, to have a tailored approach to diversity, equity, inclusion, and belonging in aged care. So any organization, one organization can apply to be part of that program. At the moment, we are full. We just had opened our applications. We open every 6 to 12 months. So we're expecting to have another opening in December, January. So at the moment, we're having around 20 organizations that be part of that program across the states. So at the moment, these are the PICACs that are involved, but may change to more PICAC organizations across other states. And so this is, and the organization that participates gets sort of tailored advice on how to improve the inclusive service delivery. And they have to be obviously government-funded aged care organizations. And also they can choose from 10 sessions. They can choose 4 sessions from a catalog of 10 sessions. And that includes things like collecting diversity data, culture-appropriate care planning, setting up a diversity working group, all these sort of things. And at the end of the day, at the end of the course, the program, they get a certificate and a badge, so they can showcase the badge in their email signatures and also certificate that they have undertaken this program. If they go through the full sessions and also do the inclusive service assessment at the end, at the beginning of the program, and also at the end, there's an assessment that every organization has to do. We're also very proud that we do regional training here in Victoria. So we provide training to any aged care organization in regional Victoria, and also the partners in culture appropriate care lines across Australia. You can also contact them for regional training. But here in Victoria, we do that, and we want to do more of that. So if you are interested in receiving training for half day in your regional area in Victoria, we're happy to do a face-to-face training or online training. So just reach out to us. We have different topics, such as, the main topic that people mainly ask is an introduction into culture appropriate care planning, or sort of deeper dive into that, but we run it for 4 hours. We sort of try to mix it up with quizzes and interactive activities, especially if you're in regional Victoria. You can email us at info@culturediversity.com.au, and we're very happy to respond to your regional training needs. And this is a photo from one of the training sessions we held in Bendigo, one of the aged care providers there. We are part of the Partners in Culture Appropriate Care Alliance. There's a PICAC organization, each state and territory. We are funded to deliver the program here in Victoria, but we work very collaboratively across the alliance. For example, such as through the diversity mentoring program, other forums and activities. So if there's any questions, please feel free to contact the PICAC Alliance. I'm also representing the PICAC Alliance at a number of reference group. This is another advice that we provide to the government. We currently want to ask the government to consider to develop a multicultural aged care strategy. So as PICAC Western Australia and PICAC Victoria, we are the spokesperson for the PICAC Alliance, which I just mentioned before about the PICAC Alliance, to advance the development of a national multicultural aged care strategy, something that is just in its initial stages, in the sense that we asked or provided advice to the department for consideration to develop such a strategy, and obviously then consult with the sector on a large scale. But that's something we hope to be able to talk to the government, that we need that strategy, because you see the diversity framework is from 2017. I think we need a refreshed look at that, and maybe have a more targeted approach when we talk about culture inclusive or culture appropriate aged care. So we're in the process of working on that and hoping that we can achieve that, influence the sector there. But obviously, it doesn't just depend on us. And then the advisory groups that I'm involved that I thought that are relevant sort of nationally, there are these two that you can see on the screen. One is the Diversity Consultative Committee, which is the most high-level diversity committee for aged care at the national level, and that's run by the Department of Health and Aged Care. And also the Aged Care Quality and Safeties Commission called Reference Group, which is looking at better engagement with multicultural communities, aged care providers, and the wider aged care sector. And then the cultural care plan. Yeah, we're very pleased that we developed the cultural care plan. The cultural care plan is a resource, a tool that any aged care organization can use to refine and improve their own care planning tools, their own care management systems. I will show you an example how it looks like, but basically it is an opportunity for the organization to include or make reference to cultural, linguistic, and face relevant considerations when doing your care plans as an organization. And you can download the cultural care plan under our resource tab of the website. We also at the moment in the process of developing, we have developed the easy English version of it, but we're also developing that into different languages. And once you see our website, once you have a look at the website, you will also see that we have a clickable Word version, so you can adapt that plan to your own organizational needs. Now, I'll show you how it looks like. It's a very simple form, name of the person or the client, the date, and then some questions. What is important for you in terms of person-centered care, but specifically from a cultural, linguistic, and face lens? So, for example, is there any days of cultural significance that you like to celebrate? Do you have any particular culturally appropriate food or dietary requirements? And if there's specific music from your cultural background that you would like to listen, look, this is something, as I said, you can adapt to your own organization. You can use it in your own organization and change it if you like, if you think you would like to change the questions or integrate it as an attachment into your current client care planning and management systems.
Now I'm going to talk to you about some other resources that we have in the center. We have multilingual health and aged care information, and these are popular resources that can assist in the work of the aged care providers with consumers who are from culturally and linguistically diverse backgrounds. As you can see, that link that is on your screens, you can download these resources from there. And we have a lot to choose from. We have aged care services, we have health and well-being, we have mental health, we have safety, financial issues, so everything that is related to COLD community and COLD seniors and providers that will help them better assist seniors from culturally and linguistically diverse backgrounds. Our most popular resource, this is the communication cards and aged care signage. We basically developed communication cards and bilingual phrases that can depict a range of activities and situations that are encountered daily by the consumers. This can prompt and assist with directions and with other communication relating to everyday topics like food, drinks, personal care, feelings, everything that a senior can experience and can communicate in other languages. They are available in 71 languages and they're free to download from our website. And this has genuinely been the most popular resource. So check out our website by going to the multicultural resources on the homepage. Now, we also provide training programs from across the sector, and these help to enhance the capabilities and capacity of aged care providers. The training programs from the sector provide other training materials besides our own that can help in the development of aged care providers how to better assist COLD seniors. This can be found through the training programs from across the sector and on our website through the training and development page. Practice guides are developed to help aged care providers with many resources and tips on how to improve the care for seniors and how to provide many other resources that seniors need. And we speak about many topics like end-of-life care, food and nutrition, inclusion plan in aged care. The last one was empowering and supporting a culturally diverse workforce. And we include important statistics, we include important resources and programs that help aged care providers to empower and support the workforce. So you can find those from our homepage. You can ask for what you need from aged care services. Is a video that we produced together with Red Hat Films, and it's available in 45 languages. This aims to raise awareness for all the people from culturally and linguistically diverse backgrounds in terms of to ask for what they need from aged care services. And you can find it on our website and on our YouTube channel.
أود أن تفهم العاملة التي تأتي إلى منزلي ما هو مهم بالنسبة لي.
क्या सामाजिक सहायता समूह से मैं पूछ सकती हूँ किस प्रकार का मुझे भोजन चाहिए?
म हरेक मङ्गलबार मन्दिर जान्छु के मेरो श्रीमतीको व्यक्तिगत हेरचाहकर्ता मङ्गलबार आउन सक्छ?
去社团找我的朋友对我来讲是很重要的，你能帮我吗？
هل يمكنني الحصول على مترجم؟
हामीले तपाईहरुको यो वृद्ध हेरचाह घर मेरो श्रीमतीको लागि चुन्यौं भने के हामीले हाम्रो चाडबाड यहाँ मनाउन पाइन्छ अनि साथै खानेकुरा ल्याउन पाइन्छ?
All of those questions are really important. People using aged care services have the right to care and services that make them feel respected and heard. So when you and your family speak to aged care services, it's really important to let them know what your individual needs and wishes are. It's also important to let them know when your wishes, your needs, or your rights are not being met.
Služba kaže da ja ne mogu imati prta. Kako ja mogu podnijeti žalbu?
我在这里很孤独，因为大家都在说英语。我想看中文电视频道，不知道去问谁呀。
सामाजिक सहायता समूह उस प्रकार का भोजन परोसना भूल जाते हैं जिसका सेवन मैं कर सकती हूँ। मैं उन्हें कैसे बताऊँ कि मैं ये उनका भोजन नहीं खा सकती?
म मन्दिर जाँदा तपाईले पठाउनु भएको मेरो श्रीमतीको हेरचाहकर्ताले हाम्रो भाषा बोल्दैन। म घर पुग्दा मेरो श्रीमती साह्रै दुखी थिइन् किनभने हेरचाहकर्ताले उहाँले बोलेको बुझ्न सकेनन्।
You and your family have the right to complain or to give feedback to your aged care provider. You can do this in person, on the phone, or in writing. You can ask for an interpreter if you like in your preferred language. The aged care provider must keep your complaint private if you ask them to do so. On the other hand, if you are happy with the service provided, it is good to give the aged care provider a compliment.
很高兴在社团里能见到我的朋友，感谢你们把我送来这里。
Hvala što ste mi organizirali hrvatski radio program. Osjećam se sretno. जो भोजन मुझे पसंद है उसको प्रदान करने के लिए बहुत-बहुत धन्यवाद.
إن العاملة التي تأتي إلي وتساعدني لطيفة جدا وأشعر أنها تحترمني.
You can ask for what is important to you from aged care services. You can make a complaint or give them a compliment about their services. Aged care services must provide you information in a way that you understand.
Aged care services must answer your questions in a way that you can understand. You can ask for what you need from an aged care service.
That was the video that you can watch from our YouTube channel and on our website. So hopefully that will also help raise awareness in providing feedback and expressing what seniors need and want from the aged care provider. We also have our podcast. These podcasts have been developed to fill the gap in storytelling and relating to seniors from diverse backgrounds, and aims to promote discussions around diversity in aged care and to support the need of culturally and linguistically diverse older people, their carers, their families. And we developed it to ask the question, how can we create more inclusive care so everyone has a fair go? People who are on this podcast have great expertise and experience in the sector. We do storytelling. We also have managers and directors who speak of policy changes and procedures in the aged care and what can be changed, what can be improved. Hopefully you will get inspired and listen to our podcast. In season 1, we spoke about projects and programs that aim to make the aged care system more inclusive. And in season 2, we talked about senior leaders from culturally and linguistically diverse backgrounds, about belonging, about migration, how to write migration stories, and advocating for seniors' rights. Season 3 was all about the workforce and how to support a culturally diverse workforce. And in season 4, we will talk about social isolation experienced by seniors from culturally and linguistically diverse backgrounds. We will play you a clip from one of the episodes.
Ultimately, staff must be safe at work, psychologically and physically. So if they are having a continuous problem with a particular client or family, then there's all sorts of steps you can take to either remediate that relationship or maybe even just to reassign the staff member so that they are looking after somebody else.
That was Bianca Brijna talking about racism and how to support culturally and linguistically diverse workforce. She basically was saying that staff has to feel safe at work and supported, and she also spoke about some other ways how to better approach difficult situations in the workplace. So I will highly recommend to listen to that episode, and you can find that on our website. This is where you can find our podcast on news and events podcasts, and you can listen to Spotify, Apple, and Google platforms for episodes that you choose. We also have a poster that is free to download from our website, and it promotes culturally and linguistically diverse services that we offer. Have a look at that one, and if you can promote that in your organization, that would be great. The Resources Partnership Program. This is a new program that we have developed, and it supports aged care organizations to embed key diversity resources into their learning management systems and their internal communication campaigns. So to join, you have to review the 10 resources that we offer. You can use the form on our website as the link below. Complete the form, agree to the terms and conditions, and we will contact you with all the resources and images and links that we provide. And you can you can promote that into your learning management systems. So feel free to email us on that one. Newsletter, we just like to mention that we have quarterly newsletter that we offer, and it's a simple sign-in from our homepage.
It was a pleasure that we were able to present our activities and our resources to you, and hope we will be in touch with you. Thank you very much.